Okay, now I'm going to inspect the upper extremities. I'm looking for size, symmetry, color, any venous patterns, and edema, and I don't see any. And I'm looking at the lower extremities for the same thing: temperature, size, symmetry, color, venous patterns, and edema, and I'm not seeing any abnormalities. Now I'm going to palpate the upper extremities for the temperature, radial, and brachial pulses. I'm going to note the pulses as weak, bounding, and I'm going to do the rate and rhythm. And you need to palpate for 1 full minute to get the rate. That's the brachial. And this is the radial. Okay. And then I'm going to do the same for the lower extremities. I'm going to look at the skin for the temperature. I'm going to feel for any edema, and if edema is present, I'm going to see if it's pitting or not, and then the depth of that pitting. I'm going to move the camera so you can see. I'm going to feel for the femoral pulse. Now I'm going to feel the popliteal. I'm going to have you take off your shoes. The popliteal, the dorsal pedis, and the posterior tibia. Okay. Thank you. Welcome. And then I'm going to note for those pulses, I'm going to note the bounding. If it's bounding weak, diminished, the rate and rhythm again, and you'll want to palpate each site for a full minute for the accuracy. And now I'm going to inspect her hair. I'm looking at length, texture, dryness, and any baldness and distribution of hair, and it all looks normal. Her hair is silky and shiny. I'm going to look at her scalp for any dryness or peeling, any lesions or lumps. And none are noted. I'm going to look at her skull for roundness, symmetry, any lesions, lumps, abnormalities of shape, size, or tenderness. Is there any tenderness? Okay. I'm looking at her face for size, shape, symmetry, any lesions or abnormalities, and none are noted. I'm looking at her skin for any skin breakdown, lesions, bumps, acne, abnormal moles, or any other abnormalities, and none are noted. I'm going to inspect her eyes for the external color, shape, and any discharge, and none are noted. I'm looking at her eyebrows for hair distribution and any abnormalities or lesions, and none are noted. I'm looking at her eyelids and for normal position and without any abnormal widening or ptosis. I'm looking at her conjunctiva and her sclera for the appearance, if it's moist, dry, smooth, and without discharge. And it's white, moist, and without discharge. I'm looking at her pupils for size, shape, any direct reaction and consensual reaction to light. Which is equal. Perla is noted. I'm looking for her ears to be equal in size. And it's aligned with the corner of her eye bilaterally. And if any cerium is noted, any abnormalities. and none are noted. I'm inspecting her nose, the external nose, which is smooth. I'm looking for any abnormalities, bumps, lesions, for size and symmetry, and that's all normal. I'm looking at inferior and middle mucosa, which is pink, moist, and without lesions. I'm looking at her septum to see if it's deviated or obstruction of airflow. And can you breathe in? Breathe in. And I'm going to palpate the frontal sinus and maxillary sinus for any tenderness. Any tenderness? Okay, I'm going to inspect her mouth. Her lips are smooth and pink, moist and without any lesions. Her oral mucus is pink, moist and without any lesions or exudate. Her gums are pink and without redness or swelling. Her teeth are intact, present, white, and without any decay. The roof of her mouth is round, smooth. Her tongue, protrude your tongue. It's midline. Push up. And the strength is noted bilaterally to be the same. The roof or the floor of her mouth, stick up your tongue, is shiny. I see small veins, moist. Her pharynx is pink, symmetric, and without any lesions or abnormalities. Now I'm going to inspect the neck. It should be symmetric and centered midline. I'm looking at her trachea, which is also midline, her thyroid gland, which is non-visible. Now I'm going to palpate the trachea. I'm going to use my 3 fingers and ask her to swallow, noting any deviation or masses. Swallow. Okay. And then I'm going to palpate her thyroid using the posterior approach to feel for any masses, enlargements, or abnormalities. And swallow. Okay. And now I'm going to palpate her lymph nodes. And this is the preocular. And that's, in front of her ear. The posterior ocular, which is superficial to the mastoid process. Her occipital, which is at the base of her skull. Tonsillaire. The submandibular, midway between the angle of the mandible and its tip. The submental, which is behind the tip of the mandible. The superficial cervical, and that's the overlay of the sternomastoid muscle. And then the posterior cervical, which is the posterior triangle of the edge of the trapeze. And then the deep cervical chain, which is deep under the sternomastoid muscle. The the supraclavicular, which is above and behind the clavicle. And then the epitrochlear, which is over here with the brachial